Hello, I'm Dr. Robert Clark. For decades, I've had the privilege of sitting with patients, looking them in the eye, and talking about one of the most pervasive health challenges of our time: diabetes. The diagnosis itself is overwhelming, but the real fear, the one that keeps people up at night, isn't about the daily finger pricks or the medication schedules. It's the fear of the future, the fear of what uncontrolled blood sugar can do to the body. We're talking about complications that can steal your independence: nerve damage, vision loss, kidney failure, and a greatly increased risk of heart attack and stroke. It's a heavy burden to carry, but I'm here today to tell you that you are not powerless in this fight. While your doctor's prescriptions are the non-negotiable foundation of your treatment, there is a world of complementary, evidence-based support that can help protect your body from these devastating outcomes. Today, we are going to explore 8 powerful herbs that science suggests can be remarkable allies in preventing diabetes complications. This isn't about replacing your treatment, it's about fortifying it. Let's begin with a spice you likely have in your kitchen cabinet right now: cinnamon. But before you dismiss it as simple flavoring, I want you to understand its profound potential. More than just a delightful aroma, certain types of cinnamon act as a powerful metabolic agent. I saw this firsthand with a patient of mine. Let's call her Margaret. She was a 72-year-old retired librarian, meticulous about her diet and medication, yet she was incredibly frustrated by her post-meal blood sugar spikes. After her lunch, no matter how carefully she counted her carbs, her glucose would soar, leaving her feeling tired and defeated. She felt like she was doing everything right, but her body was betraying her. She once told me, with tears in her eyes, "Robert, it feels like I'm walking on a tightrope, and the smallest misstep sends me falling." This is a sentiment so many of you might share. Together, we decided to introduce Ceylon cinnamon into her daily routine. It wasn't a magic bullet, but over the course of 3 months, something remarkable happened. Her post-meal spikes became less dramatic, more like rolling hills than jagged mountains. This stability gave her an incredible sense of control and hope. So, how does this work? It's not kitchen magic, it's biochemistry. The active compound in cinnamon, cinnamaldehyde, is the star player. It works in a couple of ways. First, it can help slow the emptying of your stomach after a meal. Think of it like a traffic controller for your digestive system. Instead of a flood of glucose hitting your bloodstream all at once, it's a more gradual, manageable trickle. This gives your body's insulin, whether natural or injected, a much better chance to do its job effectively. Second, and perhaps more importantly, studies suggest that compounds in cinnamon can mimic insulin at the cellular level. Imagine your cells have tiny locked doors, and insulin is the key that opens them to let glucose in for energy. In insulin resistance, those locks get rusty. Cinnamon acts like a master key, helping to nudge those doors open and improve your cell's sensitivity to insulin. It's crucial to know there are 2 main types: cassia, which is common and inexpensive, and Ceylon, known as true cinnamon. For therapeutic use, I strongly recommend Ceylon because cassia contains higher levels of a compound called coumarin, which can be harmful to the liver in large doses. Now, let's make this practical. How do you use it? Margaret started with a simple, consistent habit. Every morning, she stirred 1 full teaspoon of Ceylon cinnamon powder into her plain Greek yogurt. That's it. No complicated pills, just a small intentional addition to a meal she was already eating. You could also add it to your morning oatmeal, blend it into a smoothie, or even sprinkle it in your coffee. A wonderful, comforting option is to make a simple cinnamon tea. Just steep a Ceylon cinnamon stick in hot water for 10 minutes, perhaps with a slice of lemon. The key is consistency. This isn't something you do once in a while, it's a small daily practice. And a word on dosage and safety. For most people, 1 to 2 grams per day, roughly half a teaspoon to a full teaspoon, is a safe and effective range. If you're considering a supplement, talk to your doctor first, especially if you have any liver issues or are taking blood-thinning medications like warfarin, as cinnamon can have a mild blood-thinning effect. So, here are my questions for you. When you look in your spice rack, do you see just flavorings, or do you now see a potential ally for your health? What is one meal tomorrow where you could easily incorporate this simple, powerful spice? The next powerhouse I want to discuss is one that has been a staple in traditional Chinese and Ayurvedic medicine for centuries, and now modern science is catching up to its profound benefits. We're talking about berberine. This isn't an herb itself, but rather a bioactive compound extracted from several different plants, including golden seal, Oregon grape, and barberry. I often refer to it as a metabolic master switch, and I've seen its impact on patients who felt they had hit a wall with conventional treatments alone. Let me tell you about George. George was a 68-year-old retired truck driver. His life on the road had led to years of inconsistent meals and a sedentary lifestyle, and he was now living with type 2 diabetes and stubbornly high cholesterol. His A1C was hovering just above 8%, despite being on the maximum dose of metformin. He was deeply worried about his heart. His own father had passed away from a massive heart attack at 70, and George felt like he was watching the same clock tick down. He'd say to me, "Doc, I feel like my body's engine is just running dirty, and I can't get it clean." He was feeling hopeless, as if his future was already written. After a thorough review of his case and ensuring there were no contraindications, we added a berberine supplement to his regimen. The change wasn't overnight, but at his 6-month follow-up, his lab results were startling. His A1C had dropped to 7.1%. His LDL, the bad cholesterol, had decreased by nearly 20%, and he reported feeling more energetic than he had in years. For George, it was more than just numbers on a page, it was a second chance. He felt like he had finally been given a tool to help clean that engine. The science behind berberine is what makes it so fascinating to me as a clinician. It works on a very fundamental level inside our cells by activating an enzyme called AMP-activated protein kinase, or AMPK. Think of AMPK as the CEO of your cellular energy. When you're running low on energy, AMPK gets activated and tells your body to burn more fuel. It increases glucose uptake from the blood into the muscles, heart, and other tissues, and it helps the liver reduce its own glucose production. Incredibly, some head-to-head studies have shown that berberine AS effect on blood sugar can be comparable to that of metformin. It's a truly powerful natural compound. It doesn't just help with blood sugar by activating AMPK, it also helps improve cholesterol levels and can even support weight management by influencing fat storage. So, how can you apply this? Unlike cinnamon, berberine isn't something you sprinkle on your food. It's typically taken as a supplement in capsule form. A standard, evidence-based dosage is 500 milligrams taken 2 to 3 times a day, always with a meal. This is critical. Taking it with food not only enhances its absorption, but also helps to mitigate its most common side effects, which are gastrointestinal, things like cramping, diarrhea, or constipation. Spreading the dose throughout the day is key to maintaining stable levels in your blood and minimizing stomach upset. When looking for a supplement, you want to find a reputable brand that uses third-party testing to ensure purity and potency. Safety is paramount here. Because of its potency, berberine can interact with a number of medications. It can have an additive effect with your diabetes medications, potentially causing your blood sugar to go too low, so careful monitoring is essential. It can also interact with drugs like cyclosporin, and you should avoid it if you have significant liver or kidney disease. This is absolutely one of those supplements that requires a conversation with your doctor before you even think about starting it. Here are my questions for you today. Are you feeling stuck, as if your current treatment plan has taken you as far as it can? Have you ever considered that a natural compound could work on a similar pathway to a pharmaceutical drug to support your metabolic health? Let S move on to an herb with a fascinating name and an even more fascinating function. Gymnema sylvester. In Hindi, its name, gurmar, translates to sugar destroyer, and for thousands of years practitioners of Ayurvedic medicine have used it for that exact purpose. It's a woody vine native to the tropical forests of India, Africa, and Australia, and its power lies in its unique ability to interact with our sense of taste and our digestive system. I remember a patient, a delightful 65-year-old woman named Carol, who had an insatiable sweet tooth. She was a baker, famous in her family for her pies and cookies. Her diabetes diagnosis felt like a cruel joke. "Dr. Clark," she'd tell me, "it's not just food, it's joy. It's how I show love. Now it feels like poison." Her biggest struggle was the constant, nagging craving for sugar, especially in the late afternoon. It was a battle of willpower she felt she was losing every single day, and the guilt that followed was eroding her spirit. We discussed Gymnema sylvester as a potential tool to help her regain control. She began taking it as a supplement before her meals. About a month later, she came into my office with a smile I hadn't seen in a long time. She told me something amazing. She had baked a batch of her famous chocolate chip cookies for her grandchildren and, out of habit, popped one into her mouth. But it tasted different. The intense, addictive sweetness was gone. It was just bland. For the first time, she said, I felt like I was in charge of the cookie, not the other way around. This simple change helped her break the craving cycle and make healthier choices feel natural rather than forced. The science here is wonderfully direct. The primary active components in gymnema are called gymnemic acids. Their molecular structure is very similar to that of glucose. This allows them to do two remarkable things. First, when you take it, these acids can bind to the sweet taste receptors on your tongue. They essentially fill up the parking spots for sugar molecules. So, when you eat something sweet, the sugar has nowhere to park, and your brain doesn't receive that overwhelming signal of sweetness. This can dramatically reduce the pleasure and craving associated with sugary foods. The second mechanism is even more critical and happens inside your intestines. The gymnemic acids can also bind to the receptors on the lining of your intestines, blocking the same spots where sugar is absorbed. This means that fewer sugar molecules pass from your gut into your bloodstream after a meal, leading to a lower post-meal blood sugar spike. Some research even suggests that Gymnema sylvester may support the regeneration of insulin-producing beta cells in the pancreas, though more research is needed to fully understand this effect. For practical application, Gymnema is available in several forms: capsules, powders, or even teas. A common dosage for the capsule form is 100 milligrams, taken 3 to 4 times a day, ideally about 10-15 minutes before your main meals to get that sugar-blocking effect in place. If you're using it to specifically curb cravings, you can even find extracts or lozenges that you can take when a craving strikes. As always, safety first, because it lowers blood sugar. Combining it with insulin or other diabetes medications can increase the risk of hypoglycemia or low blood sugar. You need to be vigilant about monitoring your levels and work closely with your physician, who may even need to adjust your medication dosages over time. It's also generally recommended to avoid it during pregnancy and breastfeeding. So, let me ask you, what is the one craving that you feel consistently undermines your efforts to be healthy? Can you imagine what it would feel like to be in the driver's seat? To have that craving lose its power over you? Now I want to talk about a humble seed that is a true nutritional giant, especially for those managing diabetes. I'm talking about fenugreek. This is an herb that has been used for millennia, both as a culinary spice, particularly in Indian cuisine, and as a potent medicinal plant. It has a unique, slightly sweet, nutty flavor, but its benefits go far beyond the kitchen. It's a powerful ally for blood sugar control and digestive health, something that can make a world of difference in the daily management of diabetes. I think of my patient, David, a 59-year-old contractor who was diagnosed with prediabetes. David was a big guy with a big heart and an even bigger appetite. His main issue was satiety. He never felt full. He'd eat a large meal and be hungry again an hour later, leading to constant snacking on processed foods he kept in his truck. He was gaining weight, his energy was low, and his fasting blood sugar was creeping higher and higher. He was terrified of the diagnosis turning into full-blown type 2 diabetes. "I feel like a bottomless pit, Doc," he told me, "and it's running me into the ground." One of the first things we worked on was incorporating fenugreek seeds into his diet. I suggested a very simple method, soaking 1 tablespoon of the seeds in a glass of water overnight, and drinking the water and chewing the seeds in the morning on an empty stomach. The first thing he noticed wasn't a change in his blood sugar, but a change in his hunger. He called me a few weeks in and said, "It's the strangest thing. I have my breakfast, and I'm actually satisfied until lunch. The urge to grab a bag of chips mid-morning is just gone." By helping him control his appetite, fenugreek empowered him to make better food choices throughout the day. Over the next 6 months, combined with other lifestyle changes, he lost 25 pounds, and his fasting glucose returned to the normal range. He had successfully reversed his prediabetes. The science behind fenugreek is rooted in its incredibly high fiber content. The seeds are about 50% fiber, a large portion of which is soluble fiber. When you consume it, this fiber absorbs water in your stomach and intestines, forming a thick, gel-like substance. This gel has several benefits. First, as David experienced, it dramatically increases feelings of fullness and satiety, helping to reduce overall calorie intake. Second, it slows down the digestion and absorption of carbohydrates and sugar. This prevents the sharp, dangerous blood sugar spikes after a meal, promoting a much more stable and gentle glucose curve. But that's not all. Fenugreek also contains an unusual amino acid called 4-hydroxyisoleucine, which appears to have direct effects on insulin secretion. It seems to enhance the pancreas's insulin response in the presence of glucose, making your body's own insulin work more efficiently. So you get a dual benefit: slower sugar absorption and better insulin function. Now, for the practical side. The method David used, soaking the seeds overnight, is a traditional and effective way to consume them. The seeds become softer and less bitter. You can also grind the seeds into a powder and add a teaspoon to soups, stews, or even yogurt, though the flavor can be quite strong. If you're not fond of the taste, fenugreek is widely available in capsule form. A typical dose is around 2 to 5 grams per day with meals. A word of caution is necessary, however. Due to its high fiber content, it can sometimes cause gas or bloating, especially when you first start taking it. Starting with a smaller dose and gradually increasing it can help. Most importantly, because of its potent effect on blood sugar, it must be used with care alongside diabetes medications. It also has a uterine-stimulating effect, so it should be completely avoided by pregnant women. Let me leave you with this to ponder. How much of your struggle with blood sugar is tied to the struggle with hunger and satiety? Have you ever considered that the solution might not be about willpower alone, but about giving your body the right tools, like fiber, to regulate itself? For our 5th herb, we turn to a celebrated root from the world of traditional medicine, one that is renowned for its ability to help the body adapt to stress and find balance: ginseng. Specifically, I want to focus on American ginseng, or Panax quinquefolius. While many types of ginseng exist, the American variety has shown particular promise in the realm of blood sugar regulation. It's often considered a more calming and cooling adaptogen compared to its more stimulating Asian counterpart. I've found it to be particularly helpful for patients who are not only dealing with the metabolic aspects of diabetes, but also the profound fatigue and brain fog that can so often accompany it. I'm thinking of a patient named Susan, a 62-year-old retired accountant. Susan was diligent with her medication and diet, but she was plagued by a persistent, bone-deep exhaustion. She described it as feeling like her mind and body were wading through thick mud every single day. Her blood sugar was reasonably well controlled, but her quality of life was suffering. "I have the time to enjoy my retirement," she told me, "but I don't have the energy. I feel like diabetes has stolen my vitality. This kind of fatigue is common. Managing a chronic illness is stressful, and fluctuating blood sugar levels can be incredibly draining on the body's energy systems. We decided to introduce American ginseng into her wellness plan. She began taking a standardized extract each morning. It took about a month for her to notice a real difference, but when she did, it was significant. She started waking up feeling more refreshed. The afternoon slumps that used to require a long nap became less frequent and less severe. Her thinking felt clearer. "I feel like the fog is finally lifting," she reported. And interestingly, we also noticed a subtle but consistent improvement in her fasting blood sugar levels. For Susan, the ginseng didn't just help her numbers, it helped her feel like herself again. The mechanism of American ginseng is complex and multifaceted. The active compounds are called ginsenosides, and they appear to influence blood glucose in several ways. One key action is enhancing the secretion of insulin from the pancreas. Another is increasing the sensitivity of body tissues to that insulin, meaning each unit of insulin does a better job of getting glucose into the cells. But where American ginseng really shines is in its effect on post-meal blood sugar. Studies have shown that taking it before a meal can significantly blunt the glucose spike that follows. It seems to work in part by slowing the absorption of carbohydrates from the gut, similar to what we discussed with high-fiber herbs like fenugreek. This effect can be quite pronounced. This makes it an excellent tool for improving that all-important A1C metric, which is heavily influenced by post-meal glucose levels. When it comes to using it, American ginseng is most often found in capsules, extracts, or as a dried root that can be made into tea. The timing is important. For blood sugar control, research suggests that taking it 40 minutes to 2 hours before a meal is most effective. A common dose is between 1 to 3 grams of the dried root or an equivalent extract. It's generally best to start low and see how your body responds. As with all the herbs we're discussing, you must be cautious. Ginseng can interact with blood thinners like warfarin, and its blood sugar lowering effect means you need to work with your doctor to monitor your levels closely to avoid hypoglycemia. Some people may also find it affects their sleep if taken too late in the day. So, let me ask you to reflect on this. Is your journey with diabetes just about the numbers, or is it also about your energy, your mental clarity, and your overall quality of life? Are you looking for solutions that not only manage your glucose but also help you feel more alive and engaged each day? Let's now turn our attention to an organ that is absolutely central to metabolic health, but is often overlooked in conversations about diabetes: the liver. Your liver is a workhorse. It stores and releases glucose, it processes nutrients, and it detoxifies your body. In the context of diabetes, a healthy liver is non-negotiable, and the undisputed champion of liver-protective herbs is milk thistle. The active ingredient in milk thistle, silymarin, is a powerful antioxidant and anti-inflammatory compound that has been used for centuries to support liver health. This is particularly relevant for the growing number of people with diabetes who also have non-alcoholic fatty liver disease, or NAFLD, a condition where excess fat builds up in the liver, further worsening insulin resistance. I saw a clear example of this with a patient named Frank, a 66-year-old former chef. Frank loved rich food, and over the years it had taken a toll. He had type 2 diabetes, and an ultrasound had revealed he had a significant fatty liver. His liver enzymes were elevated, and his blood sugar was becoming harder and harder to control, even with increasing doses of medication. He felt bloated, sluggish, and deeply worried about the long-term health of his liver. "It feels like I've gummed up the works, Dr. Clark," he said. "My whole system feels clogged." Frank's feeling of being clogged was remarkably astute. His fatty liver was acting like a dam, preventing his body from properly managing glucose. We made significant dietary changes, of course, but we also added a high-quality milk thistle supplement to his daily regimen. It was a slow and steady process. We tracked his liver enzymes every few months. Gradually, beautifully, they started to come down. As his liver function improved, we saw a corresponding improvement in his insulin sensitivity. His need for medication began to decrease for the first time in years. He lost weight, his energy returned, and a follow-up ultrasound a year later showed a marked reduction in liver fat. He had unclogged the system. The science of how milk thistle works is centered on silymarin's ability to protect liver cells, called hepatocytes. It acts as an antioxidant, neutralizing damaging free radicals that are produced during normal metabolic processes, especially when the liver is under stress. It also stimulates protein synthesis, which helps the liver regenerate and repair damaged cells. Furthermore, silymarin has anti-inflammatory properties, which is crucial because chronic, low-grade inflammation is a key driver of insulin resistance and fatty liver disease. By reducing inflammation and oxidative stress in the liver, milk thistle helps this vital organ perform its glucose-regulating duties more effectively. A healthier liver is simply better at responding to insulin signals. Incorporating milk thistle is straightforward, as it is almost always taken in a standardized capsule or extract form. You want to look for a product that is standardized to contain 70 to 80% silymarin to ensure you're getting a therapeutic dose. A typical dosage ranges from 150 to 300 milligrams, 2 to 3 times per day. It's generally considered very safe, with few side effects, though some people may experience mild laxative effects. In terms of drug interactions, it's relatively benign, but it can have a mild effect on certain liver enzymes that metabolize drugs. So it's always wise to review your full medication list with your doctor or pharmacist. It's especially important for anyone with a history of hormone-sensitive conditions to consult their physician, as milk thistle can have mild estrogenic effects. So, here are my questions for you. When you think about managing your diabetes, how often do you think about the health of your liver? Could supporting this single, vital organ be a missing piece of your wellness puzzle, helping your entire metabolic system function more smoothly? Now, for our 7th herb, we're going back to the spice rack for what I consider to be one of the most powerful anti-inflammatory agents on the planet. Turmeric. The vibrant golden yellow spice that gives curry its characteristic color is more than just a seasoning, it is a profound medicinal plant. The magic lies in its main active compound, curcumin. Chronic inflammation is a silent, destructive fire within the body, and it is a major underlying factor in the development of insulin resistance and nearly every single long-term complication of diabetes, from neuropathy and retinopathy to heart disease and kidney problems. Quenching this fire is paramount to long-term health. I'll never forget a patient of mine, Eleanor, a 78-year-old retired dancer. She managed her type 2 diabetes well, but she was crippled by painful inflammatory arthritis in her hands and knees, a condition often exacerbated by diabetes. The pain made it difficult for her to get the exercise she needed, creating a vicious cycle. "Robert," she'd say, her voice tight with frustration, "I have the will to move, but my body screams in protest. How can I fight this disease if I can't even go for a walk?" Her pain was a constant source of inflammation, which in turn made her blood sugar harder to manage. We decided to add a highly bioavailable curcumin supplement to her daily routine. It took about 6 weeks, but slowly she began to notice a change. The morning stiffness in her joints began to ease. The deep, aching pain started to subside. She was able to start with short, gentle walks, which gradually became longer and more frequent. As she became more active, her blood sugar control improved dramatically. But the real victory, she told me, was being able to hold her gardening tools again without wincing. For Eleanor, curcumin didn't just help her diabetes, it gave her back her mobility and her passion. The science behind curcumin's benefits is incredibly robust. It is a potent inhibitor of a molecule called NF-kappa B, which is a master switch that turns on the genes related to inflammation. By dampening this switch, curcumin helps to cool down the inflammatory processes throughout the body. This systemic anti-inflammatory effect can improve insulin sensitivity, protect the delicate beta cells in the pancreas that produce insulin, and safeguard the lining of blood vessels from the damage that leads to heart disease and other vascular complications. It is a true full-body protector. However, there's a critical catch with curcumin. It is very poorly absorbed by the body on its own. Simply eating turmeric powder is not enough to get a therapeutic dose. To make this practical, you need to look for a supplement that is specifically formulated for high bioavailability. This usually means it's combined with piperine, or formulated with phospholipids that dramatically enhance absorption. Without this, most of the curcumin will pass right through your system. A typical therapeutic dose of a high-quality curcumin extract is around 500 to 1,000 milligrams, taken once or twice a day with a meal that contains some fat, which also aids absorption. Making a golden milk latte by warming milk, or a dairy-free alternative with turmeric, a pinch of black pepper, and other spices like cinnamon and ginger can also be a wonderful, comforting way to get some anti-inflammatory benefits. A word of caution. Curcumin has a blood-thinning effect, so if you are on medications like warfarin or even aspirin, you must consult your doctor. It can also increase the risk of kidney stones in susceptible individuals and should be used with care if you have gallbladder issues. Here is my final thought for you on this subject. Are you actively fighting the silent fire of inflammation in your body? Do you see how addressing this one root cause could have a cascading positive effect on your joint pain, your heart health, and your blood sugar all at once? For our final herb, let us explore a unique vegetable that has a long history of use in traditional medicine for its glucose-lowering properties: bitter melon. As its name implies, it is indeed quite bitter, a taste that modern palates often shy away from. But in this case, the bitterness is a sign of its potent medicinal compounds. It's a tropical vine grown in Asia, Africa, and the Caribbean, and it looks like a warty, bumpy cucumber. While it may not be a staple in the Western diet, its effects on blood sugar are so notable that it deserves a place in this discussion. It acts in multiple ways that are incredibly beneficial for someone with diabetes. I often think about a patient named Richard, a 70-year-old man who had recently immigrated from the Philippines, where bitter melon, or ampalaya as he called it, was a common part of the diet. Richard was struggling to adapt to the American diet, and his A1C had climbed to nearly 9%. He felt a deep sense of disconnect from the foods he grew up with, foods he believed kept him healthy. He told me, "Back home, we ate the bitter things. It keeps the blood clean. Here, everything is sweet." We worked together to help him find sources of bitter melon at local Asian markets and discussed how to incorporate it back into his diet in a healthy way. Steamed or in stir-fries with lean proteins, not deep-fried. We also added a concentrated bitter melon extract in capsule form to ensure a consistent, therapeutic dose. For Richard, this was more than just medicine, it was a return to his roots. Reconnecting with this traditional food, alongside his modern medications, felt empowering. Over the next several months, we saw his A1C come down significantly. He felt he was finally giving his body something it recognized and knew how to use. The science behind bitter melon is fascinating because it seems to attack high blood sugar from 3 different angles. It contains at least 3 active substances with anti-diabetic properties, including charantin, which has been confirmed to have a blood glucose-lowering effect, vicine, and an insulin-like compound known as polypeptide P. These compounds work together to help reduce the amount of glucose the liver releases, increase glucose uptake by the muscles and fat cells, and some evidence suggests it may even have a modest effect on pancreatic insulin secretion. It essentially provides a triple-action support system for the body's own glucose management. So, how can you use this? If you are adventurous, you can certainly cook with the fresh melon. The key is to manage the bitterness, which can be done by salting and rinsing it before cooking. It's often used in stir-fries, soups, and stews. For a more standardized approach, bitter melon is widely available as a supplement. in capsules, powdered extracts, or as a juice. Dosages can vary widely depending on the preparation, so it's essential to follow the manufacturer's instructions and, of course, discuss it with your doctor. A typical dose of a powdered extract might be in the range of 500 to 1,000 milligrams, 2 to 3 times per day. The main safety consideration, as with all these potent herbs, is the risk of hypoglycemia. Because it actively lowers blood sugar, combining it with your prescribed medications requires careful monitoring. It should also be avoided during pregnancy. We've covered a lot of ground today, from the familiar cinnamon in your kitchen to the more exotic bitter melon. The common thread is that you have more tools at your disposal than you might realize. These are not replacements for your medical care, but powerful, science-backed allies. This leads me to a few questions I'm often asked. One is, Dr. Clark, can I stop my metformin if I take these? The answer is an emphatic no. These herbs are complementary. They support your body and help your medications work better, but they are not a substitute. Another question is, which one is the best? There is no single best one. The right choice depends on your specific challenges. Is it cravings, liver health, inflammation, or post-meal spikes? This is why the conversation with your doctor is so important. Your journey with diabetes is unique. It's a long road, but it does not have to be a journey of fear. It can be one of empowerment, of taking control, and of using every tool, both from the pharmacy and from nature, to build a healthier, more vibrant future. What is one step, however small, you can take this week to begin this journey?